Here I'm going to talk about vitamin D supplement and prevention of cancer and vascular disease. Definition: Vitamin D is important for good overall health and a strong and healthy bone. It's also an important factor in making sure your muscle, heart, lungs, and brain work well, and that your body can fight infections. Your body can make its own vitamin D from sunlight. You can also get vitamin D from supplements, and very small amounts come from a few foods you eat. Long prescribed to prevent and treat bone-related disorders, supplemental vitamin D has been viewed in recent years as potential strategy for preventing cancer and vascular disease.
Vitamin D is a key nutrient which promotes calcium absorption within the intestine. Vitamin D is a fat-soluble compound which is absorbed by the body during fat absorption within the gut. It enters the circulation and binds to the vitamin D binding protein. This protein is involved in transporting vitamin D to target tissues, including the liver. Vitamin D undergoes a number of metabolic steps before it gets converted into its active form. This process begins with its hydroxylation within the liver, forming calcidiol. Calcidiol then enters the circulation, where it binds the vitamin D binding protein and is transported to the kidney. Within the kidney, a further hydroxylation step occurs and calcidiol is converted to calcitriol, the active metabolite of vitamin D. The vitamin D binding protein then transports calcitriol to target tissues, including the intestine and bone. Within the intestine, calcitriol increases the expression of calbindin, a protein whose calcium buffering properties promotes calcium uptake from the gut into the enterocyte. Calcium is an important component of hydroxyapatite, the inorganic constituent of bone. Therefore, a severe lack of vitamin D within our diet, which promotes calcium absorption, can give rise to conditions such as rickets or bone softening. Vitamin D plays an important role in determining the mineral density of bone, an indicator of bone tissue strength. Therefore, the presence of vitamin D within our diet is important for the development of healthy, strong bones during bone growth and development in infancy and childhood, as well as maintenance in later life.
Application: Laboratory studies have shown the presence of vitamin D receptors in many tissues and have suggested possibly vitamin D pathways that may be related to cancer and vascular disease. An observational study have shown associations between low serum level of 25-hydroxyvitamin D and increased risk for cancer and vascular disease.
Okay, so hundreds of studies have shown how vitamin D can prevent as many as 30 different kinds of cancer. But how does it work? Well, here's the thing. Vitamin D is actually a hormone, and its primary function is cell management. Yeah, in fact, more than 90% of this important hormone is created when your skin is exposed to UVB light. All right, so check this out. Throughout your body, millions of cells are constantly reproducing, right? Every one of these cells has a vitamin D receptor, and for good reason. Occasionally, something goes wrong with the cell and it mutates. When this happens, vitamin D plugs into that cell and sends a message to the nucleus telling it how to repair itself. If the cell cannot be repaired, vitamin D tells the cell how to destroy itself. That way it won't multiply and spread throughout the body. Okay, so take a second and imagine what happens if your body doesn't have enough vitamin D. Yeah, the mutating cells multiply uncontrollably and can spread throughout your body. But hey, wait a second. If your body has enough vitamin D, it can fix or destroy those mutating cells before they multiply and allow the disease to take hold. Cancer prevention is just one of the many benefits of the vitamin D hormone. That's why it's important that we get regular UVB exposure for the most natural and effective way to maintain optimal blood levels of vitamin D.
Pros and cons. Pro. Vitamin D may inhibit cardiogenesis and slow tumor progression, including promoting of cell differentiation, inhibition of cancer cells proliferation, and anti-inflammatory, immunomodulatory, proapoptotic, and antigenic effects. Vitamin D may decrease tumor invasiveness and propensity to metastasis, leading to a reduced rate and death from cancer.
So many of you as breast cancer patients are likely thinking, what's the role of vitamin D in my treatment? Vitamin D, you're a breast cancer patient, survivor, you're trying to do everything you can to improve your life and improve your survivorship. What are your thoughts about vitamin D in the breast cancer patients?
I think that vitamin D has a really important role to play in survivorship. Vitamin D and calcium. We know that for all cancer patients who increase their vitamin D level by even 10 or 15 nanograms per mil, that there's a dramatic, more than 70% reduction in their risk of cancer progression, risk of new cancer. So anything that can to be done that can encourage vitamin D supplementation, calcium supplementation, healthy lifestyle, as we all know that we try to encourage our patients to do, those things rolled in with calcium and vitamin D will only be beneficial. And the other benefit is that calcium and vitamin D has a very positive and protective effect on the skeleton. The response of the skeleton is very robust. Your skeleton will be healthier. Your cancer will be gone. Your chances of getting repeat cancers or metastasis or progression of the tumor in the skeleton is also likely lower.
But there's a very, very important message here, and that is that breast cancer patients, now that they're entering into their survivorship phase of their life, they really need to know what their baseline vitamin D level is.
Yes.
Cons. The use of vitamin D did not lead to a significant difference in many of the secondary vascular endpoints or in the rate of death from any cause in the overall cohort in subgroups. Alternative, because of volumetric deletions or decreases bioactivities from vitamin D, overweight and obese persons may require highest doses to derive a benefit with respect to cancer.
5.4 million Americans suffer from heart failure, a debilitating and progressive disease that impedes the heart's ability to pump sufficient blood to the body's organs. One of the things that puts individuals at greater risk for cardiovascular disease and heart failure is a deficiency in vitamin D.
We ask simply the question, how does vitamin D affect heart and cardiovascular functions? And over these decades, what we've shown is there's dramatic and very important effects. We've shown that cardiac hypertrophy, or just enlargement of the heart, occurs in vitamin D deficiency. Vitamin D that you would get at your local drugstore is useful for treating vitamin D deficiency. And that is important, but it doesn't relate to our research. We know that vitamin D deficiency can result in cardiovascular disease, but the kind of therapeutic that we're interested in developing is much more potent than vitamin D and would be effective even in an individual who has normal vitamin D. We believe at this point from the studies that drugs can be made which will be very effective in treating heart failure.
Issues in Ecuador. Initial epidemiological research shows the incidence and mortality rates from some cancers lower in individuals living in the southern latitudes, where the degrees of exposure to sunlight are high, in thus living in altitude from north. Since exposure to ultraviolet rays of sunlight leads to the production of vitamin D, to the hypothesis of the variation of the amount of vitamin D could be responsible for this association. Conclusion. It is not 100% proven that the vitamin D prevents cancer and vascular disease, but the studies and observational studies have suggested that people who take vitamin D supplement may have a lower risk of many diseases.
Seven unusual signs that you're lacking vitamin D. Did you know that before the year 2000, most doctors believed that none of their patients could be vitamin D deficient? But as technology to measure for vitamin D became affordable, more studies were conducted. According to Dr. Michael Holick, who is one of the leading vitamin D researchers, the Center for Disease Control and Prevention, the CDC, reported that 32% of adults and children in the US were vitamin D deficient. That's a pretty high number. So for that reason alone, it's important that you look for signs of vitamin D deficiency. With more research being conducted, Holick believes that about 50% of the general population may be at risk for vitamin D deficiency. The only way to know for sure if you are vitamin D deficient is by a blood test. But the signs and symptoms that come along with this deficiency could be helpful as well.